Hey everyone who's just joining, just waiting for Luke to come onto the live so that we can start our Q&A. Hope you've all had a great day or good morning wherever you are in the world. Hello, Anna Pilates Studio, Spiral Physio, good to have you on. Bree, also great to have you on. Luke has joined. Now we'll wait for Luke to actually join the live with me.
We're in.
We are on.
Good.
Hello, Luke. How are you going?
Yeah, good. Thanks, Train. It's the first time on the on Instagram Live. So very honoured to be joined by you and hopefully showing me the way, holding the ropes as we go through.
Awesome. And Jono's just said hello. So hey, Jono, hope you're having a good day. All right. We're just giving everyone a chance to jump on as well. But maybe we can even start off by introducing ourselves to anyone who may not be familiar with each of us, and then we can give everyone a bit of a rundown about what we're going to talk about today. So Luke, do you want to get started?
Yeah, so g'day everyone. Thanks for tuning in. So I'm a sports and exercise chiropractor. So I've been in practice for, this is coming up to 17 years now. Work out of Health and High Performance in Mont Albert North, down in Melbourne, where we work on quite a diverse range of patients, but mainly focusing on the active individual and an emphasis on the running athlete as well. So I've done a lot of postgraduate study in the sports injury world and sports medicine, and as a keen runner myself, found myself drawn down that path of treating more and more runners, and that's sort of one of my passions these days, is to help runners achieve their goals and get over their injuries and improve their performance.
Nice. Very well summarized. And we've already got our first question. I think it's really important that we address this right now. KC Sports Chiro. I love Luke's hair.
Luke. Yes.
What conditioner do you use?
Well, I actually did have a haircut today, coincidentally. So I struggled during our lockdown last year when all the hairdressers closed. I had to rely on my wife to give me a cut. But no, look, that is a secret. Everyone keeps trying to pry that out of me. I'm going to hold that one till my deathbed. So yeah, there is no secret. I'm fortunate to have some good genes. My mum's dad had a good head of hair till his later in life. So hopefully this will hold, despite having two kids that, I've got a few more greys coming up, but fortunately not dropping out just yet. So Curry, no, you're going to have to hold off on that, mate. And by the way, it's too late for you, mate. Your hair is gone, so it's no recovery there.
Love it. And just saying hello to everyone as well. If you not familiar with who I am, I'm Trang, physiotherapist and strength and conditioning coach, and doing running coaching as well. Also working at Health and High Performance with the wonderful Luke, and treating a range of different injuries. Always got to focus on the endurance side of things. That's my special interest. So running, triathlon injuries and coaching, but always open to treating different injuries as well. So yeah, that's what we're here for today, everyone. We're here to go through a Q&A, answering any questions that you guys have about running injuries in particular. I mean, if you have any questions about triathlon injuries, then please feel free to ask as well. I mean, that falls under the endurance banner. Or about Luke's hair, then, any other questions, feel free to send them through. But why don't we get started? We've got some questions that got sent through via the Instagram question box yesterday. So we'll cover those first. And then if you guys have any questions, then please feel free to put them into the comments. I can already see there's some questions coming through, so we'll cover those as soon as we get through the first couple of questions, just from the question box that we got yesterday. So the first question, I'll read it out now. And yeah, Luke, if you feel like that's something that you'd want to answer, then go for it. The first question, if you could add one thing to training to improve running speed per kilometer, what would that be?
Yeah, and that's a good question. I think I think every runner would love to know that, how they can run faster and what thing they need to add in. And it does really, I always hate to give this answer, but it does depend on what level you're at. How many runs you're doing a week, and what they look like. So and also doing any strength training. There's certainly things we look at. So if you're looking at a recreational runner that's maybe running twice a week, both of those are just easy runs. Well, a good thing to add in would be some speed work. So whether that's speed work or hill runs, intervals, anything like that, to add that third session in there. For a runner that's already doing that and has already got those 2 runs a week, I'd probably say looking at adding either a fourth easy run. So whether you're doing one of your runs longer, so extending that a bit longer there to get more of that aerobic conditioning, or adding an extra easy run, or perhaps at that 3 run a week, then you're looking to add a strength training session in there. So adding one of those in. And I know that's certainly a favourite of yours, Trang, and probably the answer that I'd expect yourself to give. And then as we're going up, so if you're doing 4 runs a week but not doing any strength training, well, then that's when I also would recommend adding that session in there. So I think it does depend on the level of the runner and what they're doing, their injury history there. But I'd say if you're only doing 2 runs a week, making that consistent, looking at probably adding a 3rd run in there would probably be my priority. And then and looking at speed sessions if you haven't already done that. And then going up from there, probably strength training once we're getting to sort of four runs a week. What would you think, Trang? Would you?
Yeah, I saw this question and I thought about it. And same thing as you, Luke. I was thinking it depends so much on, so many different factors. It's really challenging to put it down to one thing. But the one thing that I did think of, and it goes along with what you said, Luke, is a progressive running program. And it's a bit more of a broad suggestion, but a progressive specific running program for where you are at would be the one thing that would make the biggest difference, I'd say.
Yeah, and I think that's you're right there, that having a structured program, and that's sometimes what we see in some of the trap that I think we see recreational runners fall into, is that there's just no plan. They don't have a coach or anyone to direct or guide them, and so it can be very haphazard with their training. So they can be training twice a week in 1 week, and then 4 times the next, and then 0, and then there's just this constant up and down seesawing effect. And these are sort of some of the recreational runners that we see come in, that have injured, and you look back and review their training history, and that's one of the faults that we see. But whilst that can contribute to injury, it certainly can contribute to poor performance as well, just having that lack of consistency. So yeah, I'd absolutely agree with you. Having structure to your training is vital, and someone that knows what they're doing to get that improved performance. Yeah, that's really good.
And I think the thing with that is as well, the running coaching or the running programming scene has changed so much over the years. And it used to be that you'd have to be elite to have a running program to follow, that is actually specific to you. But nowadays it's so accessible to find a running coach or a running program that's specific for you to follow. And I'm saying specific as well because there are general programs out there. But then, like we've spoken, each person has their own weaknesses, or depending on the level that you're at. And then it's so accessible for anyone, no matter what level you're at, to have a running program. I mean, you don't have to be at a certain level. Like, if you want to get good, then that's the best way to do it.
Yeah, no, I agree with you there, and just having having another person to hold you accountable to can come in handy sometimes, because sometimes you just don't feel like doing, just don't want to do that training session, but knowing that there's someone watching over you, and we'll make sure that you get an extra motivation to get it done.
Yeah, awesome. Alrighty, I'm gonna go to the next question that was from the comments. I might actually alternate between the live questions and the previous question box questions so that we don't fall too far behind.
Yeah. Question
tapering, deloading a runner prior to a competitive long distance race for peak performance. Discuss, please. Oh, I like to discuss. Might be here for another like hour.
Yeah, and it's certainly an art form, the taper. I mean, I guess, yeah, you know, with yourself, with the coaching there, I mean, if you want to hit off on that, and then I'll add in some comments there as well.
Yeah, sure. So, tapering, deloading before a race. The main thing to take into consideration is probably the duration before a race that you want to start tapering, and then what variables are you actually tapering. So depending on the race, you might be looking anywhere between a 1 to 2, maybe even 2.5 week taper. For a long distance race, say a marathon, you might be looking at 2.5 weeks to maybe even 3 weeks. The longest run you might do 3 to 4 weeks before a long distance race like that. And then so it will depend on the length of that race, that will determine how long that taper would go for. So longer races will require longer taper, and the main variable that you want to taper would be the volume of training that you're doing, because if you taper the intensity, so how fast you're running, then you may actually lose fitness. So you want to reduce the volume, like how much running you're doing, but maintain the intensity so that you are still getting that fitness and still maintaining like the pace that you would do on race day, but then you're just doing less so that you allow that fatigue from training to dissipate, and then you can then peak on race day. What do you think, Luke?
Yeah, I think you're spot on there in terms of, you know, if you're looking at, say, you're a runner that's been doing typically 4 runs a week, well, you'll probably keep those 4 runs, but you reduce the volume of them, so reduce your mileage, but, you know, still keep the intensity up. And so if you've been used to doing, you know, 1 speed session, then you'd make sure that you get that during those 2 to 1 week. That taper there, so making sure you're getting that stimulation. I think it's also individual in that some people will respond better to shorter or longer tapers, and that comes down to almost trial and error sometimes. You know, you try a longer taper, see how it feels, try a shorter taper, and then compare. I know myself, I prefer to, you know, race week for me, I prefer to have pretty easy. I don't like to do a lot. I like to often leave sometimes 2 days off before a race. Just I find I get really fresh, whereas some people actually feel really sluggish with that. They feel that, no, they need to be, even the day before, getting out for even just a 10 or 15 minute run, you know, in their race gear to make sure that they're ready to go. But me personally, no, I like to have it off. Do you have a preference that you found in experimenting with that?
I've gone with what my coach Ryan has given me for triathlon races, where he loves to give me a short run the day before. I found that works pretty well, because then I kind of keep things moving. I do feel sluggish as well if I deload too much. But yeah, it is pretty easy so that you do let that fatigue dissipate, and then you're ready to go on race day.
Yeah, I sort of find I get all full of beans and wound up, and then I'm ready to go on the start line, and then bang, I'm off. So that works for me. But as I said, it's you know, it's an individual thing, and there can sometimes be a trial and error to see what goes best for you.
And there's different research as well on the ideal taper duration for different types of races. So yeah, the question was for running, but even for swimming, cycling, there's like slightly different taper durations, which I can't remember off the top of my head, but I think swimming might be a little bit less, and then running a little bit longer, just because of the demands of the sport. So yeah, that's something else to consider as well, the type of sport that you're doing. Alrighty, next question. So this one was from the question box yesterday. Do flush runs aid recovery? And if so, what are some principles for doing them effectively?
Yes, I think what that question, and that was Brock, shout out there to you, mate, that asked that question. What for those that aren't aware, I mean, a flush run is a run that's usually done the day after a harder session. So that would be after a long run. So if you've done your long run on a Sunday, it'd be on a Monday, or after a harder speed session, it might be done the day after that. They're also called, you know, recovery runs, or an absorption run as well too. I've heard it being termed as an absorption. I quite like that word actually. I like the term absorption run rather than sort of flush or recovery run. And what that's doing is, by definition, absorption is allowing you to basically allowing your body to absorb that training the day before. So I'm actually not aware of research that's looked into the benefits of that. I know that certainly anecdotally it can be quite good to, because often after a harder run there might be a bit of stiffness and soreness there, and some movement the day after can help to free things up there. I'm not aware of any research looking at that and risk of injury in terms of the importance of that flush or absorption recovery run. But it's certainly a very useful one. It can also be very good for the longer distance runners to get them ready for what it's like to run on fatigued legs. So doing an easier run after a harder run. I mean, we've all had that run where you're just like, oh, geez, this is really tough. But mentally it can help you to get over that as well. Any thoughts on that, Trang?
Yeah, I pretty much agree with what you've said. Yeah, I think it's like also very, like anything, very individualized. And yeah, some people find that they work well with a bit of an absorption run or flush run, and then otherwise some people will not. But then also, yeah, like the duration of that absorption run is like worth taking into consideration, because like some people might do like a recovery run for like an hour, but that, for me personally, that would be almost like a training run. So we'd want to keep it short, definitely, to make sure that's a recovery run.
Yeah, and then also I think because part of that question was how would you structure that? It wants to be easy. You don't want to be piling on a hard run in that. So it wants to be easy pace. Flatter terrain. Just ignoring your pace, just going off effort off that. So you'll probably find you will be running a bit slower than usual on that.
Yeah, cool, awesome. And going back actually as well to the very first question, a little add on, would you deload the strength exercises also? Yeah, definitely. Because you want to deload like all forms of training. My personal approach is to do the final strength training session generally like 6 days before. So if you're doing a race on Sunday, for most of my runners, program the final strength training session on Monday, no later than that. Maybe Tuesday if it's a shorter race, but even if it's a longer race, like no strength training that week is also an option. Like you don't have to do strength that week. You won't lose all your strength if you miss a week. For that week, if it's race week, running's a priority, and tapering and recovering to peak on that day is the priority. So and same thing with strength, deloading the volume rather than intensity as well as my go-to. So doing 2 sets of each of the exercises instead of 3 sets or something like that.
And then would you keep the resistance the same as well for that?
Depends on the race and on the client. Like sometimes if it's like not that much weight anyway, then just keep the resistance the same. If they're lifting heavy loads, like if they're squatting heavy, which they're not generally in the final phases leading into a race anyway, but if they were, I'd probably decrease the intensity as well.
And that's also one of the add-ons to with the tapering too, is it also comes down to, is that your A race or is that just a B race? So, is this just a half marathon that you're just doing on the way to a full marathon? And if so, you don't really want to be having an extended taper for that half if your ultimate goal is the marathon, 5-6 weeks later. So you can almost train through that or slightly taper off in the latter, even do a half a week taper, because otherwise if you're going to be tapering for that, then you're going to be missing out on fitness and training that will ultimately affect your ladder race too. So I think what we were talking about before is good for that A goal race. But if you're sort of at the lesser ones, then sometimes don't even bother taping for.
Yeah, could be good practice to do a race on fatigued legs or under a bit of fatigue. It's like good training to increase your pain tolerance threshold.
Yeah, absolutely. That's right. Yeah, we can all do with one of those. I think some of my more memorable runs have been some of the harder runs where you're just like, gosh, I wish this would end. But just shoot me now.
Definitely. Alrighty, the next question from Trace in the comments. What factors are there to consider running in postpartum period?
Oh yes, that's a really good question, and
Yeah,
one that there's fortunately been given a bit more attention to recently. There's been some papers published on that, and some light shone on previously before what was, you know, I guess a relatively ignored area, and you could, you know, throw past postpartum into pregnant women as well. Like I think in the past, a lot of pregnant women have been treated like they're fragile, and, you know, saying, oh no exercise, no elevating the heart rate through there. So I'd say, firstly, you'd want to, the main thing to be, that you want to make sure of there is pelvic floor there, and making sure that there is, that is functioning as it should. And that does depend on, you know, a lot of things depend on that, how easy the delivery was. We're also talking about, you know, whether it was a vaginal or cesarean delivery as well. That can affect the rate of recovery postpartum. So that I will. If there is some pelvic floor issues, I'll certainly refer to someone that specialises in that, because that's not my area of specialty. So we want to make sure that there isn't any stress and incontinence when running. And so that's probably the big thing to tick off. So that time frame can actually range quite big. You know, I've had some women that have run, you know, very quickly after birth, and we're talking, you know, some 3 or 4 weeks, but then others have been longer than that. You know, some for more complicated ones over 6 months to get back into that there. Anything to you to add to that, Train?
Yeah, that was the main thing that I was going to say. That take a very personalized approach, and go to your personal like health professionals who you've been working with to come up with a plan with them, because yeah, when you look around you, there's going to be people, or, you know, mothers who have been returning to running at completely different timelines, and yeah, sometimes you can get FOMO, or you can get like drawn into what other people are doing. So yeah, like definitely taking your own personalized approach with the timelines.
And the other thing too, actually, with you know, there's a pelvic floor considerations there as well too, but also in terms of breast considerations, and you know, our friends at She Science do a great job in terms of, you know, making sure with adequate fitting bra, because, you know, especially with breastfeeding, that can become quite uncomfortable for the female runner as well. So that's something that consideration as well, is not just the pelvic floor, but also proper breast support too.
Yeah, good advice. Alrighty, so next question. How to manage coccyx pain? So I think this one was kind of like, yeah, anything to do to manage pain, or to treat it as well.
Yeah, well, it's certainly not a specific runner issue. I guess that the time that we see this in a runner is if they've a trail runner that slipped over and fell on their backside, and that's never good. Coccyx pain. So yeah, it does depend on the cause of that. So because a lot of issues can refer pain into, and for those that aren't aware what the coccyx is, it's right down the very bottom of your tailbone there. So typically hurt when you've, you know, sat back on something, landed on something, you've slipped and fallen onto your backside there. Those that have hurt their coccyx will know about it. It's an extremely painful thing to have. I've certainly seen plenty in my time. As I said, certainly not unique to the runner. I've had one more recently where he was jumping on a trampoline, and the trampoline bottomed out as he was sitting down, and basically his coccyx went crunch into the ground. So firstly, you want to make sure that where that pain is coming from, because certain other lower back issues can refer pain into that and make it feel like the pain is in the coccyx. There's also certain internal things that can refer pain into there as well. So some colon issues that can cause that. True coccyx pain though is pain to touch on the coccyx, so you can pretty much feel around through there and feel that pain. I actually find that manual therapy can actually work quite well for that. Fortunately, it's something that you can work on externally without having to do anything internal. There are certain instances, and it's been certainly documented in the literature that sometimes internal manoeuvres are needed. So, but most of the time that they can respond well to manual therapy, and also just modifying sitting positions as well, so that people aren't putting direct pressure on that. So yeah, a bit of a different question there, but hopefully for the listener that asked that one, that might give some guidance.
Yeah, I always say, like, you know, there's the traditional running injuries, but then if there's any other injuries that might not fall under the running banner, just like put it in a trail running context and it'll make sense. Because, you know,
Yeah,
trail running,
yeah,
who knows what could happen there.
yeah. I think we
Coming from
all
a
had spills.
non-trail runner.
That's right. I think we all had spills out on the trail. So if you're unlucky enough to land right directly onto a rock on your backside, well, that'll certainly certainly do it. But yeah, it's one of those areas that actually self-help wise is, you know, you can use the cushion or sitting on a donut pillow, but self treatment on that is a bit difficult, and that's where you need the help of someone that's qualified to get that sorted.
Yeah, yeah,
Yeah.
for sure. All right, we'll keep moving through the questions. We've got a few more. This next one's an interesting one, and I'm like excited to discuss this. It's a common question that we get, and the question is, what should I see a physio for versus what should I see a chiro for?
Well, as a chiro, I'm just going to say forget physio, so don't worry about them. It's just come straight to me.
Trash talking comes out.
No, that's right. Well, we're work colleagues now, so we can do that. Bit of banter, but no, it is a really good question, and one that you know I get asked quite a lot. I guess traditionally in the past, the professions have been seen as quite separate. You know, traditionally chiropractors have been seen with, you know, only treating the spine, and then they'll only manipulate or adjust, and that's the only thing that they do. And then you've got physios that, you know, may have just been doing, you know, giving exercises and giving hot packs and that sort of stuff. But I think what we've seen, what we definitely have seen over the years is with information so readily available, improved teaching in the universities, evidence-based healthcare, is that we've seen a lot of blending in between the professions now, and so that it's not so much about titles anymore. It's about knowledge, you know, knowledge of that particular individual, and you know you can apply that same question to, you know, you can include osteopathy here in Australia, also even myotherapy and massage therapy. You know, when would you see one or the other? And it really comes down to, well, what's that practitioner's, you know, specialty? You know, over the years, I mean, I see injuries that, you know, things like soft tissue strains and hamstring injuries and calf strains and tendinopathies, and which traditionally would not be, you know, considered as a chiropractic thing to do. But I have done a lot of training and sort of got an increased experience in that area that I feel competent to manage those sort of injuries. And so also, it's interesting too, because, you know, I attend a lot of multidisciplinary seminars, and you know, just speaking to other physios and strength and conditioning experts, and that's pretty much, you know, what we're now seeing is there is such a blending of the professions. You know, I even put EP and S&C people in there as well too. You know, they're getting quite competent at figuring out what's going on, and working out exercise programs around that. So I think we're seeing a lot of the breaking down of the walls and a lot of similarities. So yeah, my answer in short is it depends on the practitioner and their skills. Would you agree, disagree?
Yeah, I think that's the way it is nowadays. Like, there's so much a blending of the different professions, and the fact that we're all following the same evidence-based advice. The main thing as well, actually, is the fact that, like, Luke and myself, like, we're both runners, so then we have that additional like personal experience, and working with runners, we can relate at that level as well, because then we can help with all the other different aspects of running, like whether it's like the return to running, and even have other chats like footwear or whatever it might be. But also, in different physios will do different things, but for myself, like, I don't personally don't do a lot of manipulations, so that one would be better for people to see you for, Luke.
Yeah, absolutely, and that's where, you know, combining the hands-on approach. So whether that's soft tissue or manipulation, mobilization, that sort of thing. Again, it comes down to the training of the individual. So yeah.
And then finding someone that you relate to as well, like at a personal level. So whether it's that common interest with running, or that's someone that you actually trust and you have a good connection with, because that's going to determine the success of your treatment as well.
Yeah, absolutely. Yeah, that rapport is really important. Having someone that understands, especially as, you know, as a runner, it's not necessary, but it helps to have an interest in the sport and an understanding, and especially having someone that's not just going to tell you to stop running. Which some practitioners and my experience, GPs are sometimes not as good at that, in telling patients a blanket, no, you should just stop doing what you're doing, or why are you doing that for? So that's something I think as runners ourselves, we try and avoid that where possible.
Yeah, for sure. All right, we'll fit in a couple more questions. So Irene Graciela asking how to run without pain on shin.
Okay, so I assume we're probably talking, well, it could be a few things around there. So there's a few things that can cause shin pain. So we've got pain can be around the front of the shin, or it can be more on the inside. The more common one is on the inside, on the inner part of the shin there, and that's what we refer to as medial tibial stress syndrome. The nasties to rule out with that there are stress fractures, and that's something that you don't want to be running through. Medial tibial stress and shin pains, there's a few things that we look for that. Firstly, we want to look for what's your strength like in through the legs, and usually the first thing we go for is what's your calf strength like. So some simple tests to perform at home would be doing a single leg calf raise to fatigue test, raising up and down as many reps as you can do. We've obviously got various equipment in our clinic that we'll test and assess strength for, but that's the first thing that we look for. The other thing you can assess is what's your foot strength like, and then working your way up the chain, working up to the quads, and then around through the hips there as well. So that would be a first thing at looking at strength. The other thing that we look at is looking at running technique, and there's been a few studies that have looked at the influence of running technique on participants with shin pain, and there was a particular one done in the military there, and that had some really good positive results in terms of gait retraining on those participants. So certain things you want to look for that would be impact forces. So how hard you're hitting the ground. So those that have got shin pain, encouraging them to take a lighter landing is one cue that you can use. If they're also displaying what's called an overstride, so they're landing a long way out in front of their center of mass, and there can be a lot of braking forces that go along with that. So that's something that we want to look to change as well. So we certainly look at main things we look for there would be assessing strength and assessing their running technique, and of course probably number one too is are their running loads as well. Have they just done too much too soon? And a lot of the time, we're sort of seeing now in Australia, it's AFL pre-season, and starting to see a few of these trickle in where they haven't done. Some of these guys, these are amateur footy players, haven't done a lot in the off season. Now started back running. Their running loads have spiked up, and then so have the shin pain. And so for our runners, we certainly want to look at how are you training. The management for that in terms of training loads. So medial tibial stress, if this is what this is, it can be a little bit trickier in that some respond to a little bit of like reducing the load a little bit. And then doing all those other interventions that we said, and then carrying on with a little bit of discomfort. Some though I've found actually need a bit of a spell and a bit of time off from running to really settle them down. And it's probably I guess it falls under the bony injuries, in that they're probably one of the few that you don't want to push too much into pain, so that they sometimes need to back off. I usually will approach them in that we'll, depending on where they're at with their season, like if they've got a race coming up or something important, then we'll try and run them through. But if they're sort of just running for fitness and not much is coming up, or they're a long way off from a race and we have got the luxury of just giving a bit of a rest for it, then that's sometimes what we'll do for it as well. Because I've had some where you've tried to run them through, it's just not getting better, and then you're just like, okay, look, we just need to rest for a period of time, then let's ramp it back up again and get that right. So it can be sometimes a bit of a unknown one when you're managing those. You don't know which way it's going to fall. Anything to add to that as well?
Yeah, I think you've summarized that pretty beautifully. And then it depends on what level of MTSS it might be. So whether it's a bit of inflammation, like level 1, but all the way through to a potential stress, like fracture, where you need to take the rest more seriously. So a few different things to take into consideration there. Alrighty.
Excellent.
Okay, last question for the night. I ran a half marathon a year ago and have struggled to start running more than 8 to 10 kilometers at a time because of cramps in my feet. Any suggestions for increasing my distance? And that's a question from Erin Dixon.
Erin, good question. So, firstly, we'd sort of want to get to the bottom of the issues with the cramps there. So making sure that that's not anything metabolic or neurological that could be causing that. It most likely is just exceeding its capacity of what it can handle. So a couple of things that we can look for that. So when you say you struggle to get to 8 to 10, how have you been working your way up from there? Have you been just doing sort of 4 and then you'll just jump up to 8 to 10 and see what happens there? If so, what I'd suggest is actually incrementally stepping up, gradually increasing that load, finding out where those cramps come in, and then, sticking underneath that, working at that level for a while and then building up. And you could potentially, if you're, say if you're doing 2 runs a week or 3 runs a week, then you might want to add, you could potentially add an extra run, but just again, a shorter run there. So you're getting more volume into your week. That will help to sort of build up your conditioning around that area. So that's one thing. The second thing is actually, what's your foot strength and your calf strength like? Have you got adequate foot control? So that could be things like just spreading your toes and then alternating your toes up and down, so moving that around. What's your calf strength like? So we mentioned before with that single leg calf raise there, because if there's insufficient strength through there, then they're going to hit a point where after that 8 to 10 they just sort of give up. And that's sort of been my experience with a lot of people with cramps, is that they often do lack the strength in that area, and that's where strengthening it either by resistance program or gradually building up the loads, ideally both, working on both there. So there can be a few things that are causing that there. I'm thinking also, if it's happening on both sides, there could potentially be something centrally happening around through the lumbar spine. So I'd certainly want to be getting that ruled out as well, which can affect sort of neurologically down the legs too. That'd probably be the things that I would be looking through.
Yeah, and as an add-on to what you've said, Luke, Lucy Tri Physio has asked, how would you rule out metabolic and neuro?
Yeah, so neuro, I'd be pretty confident at doing that myself. So you can perform a number of different tests, looking at neurodynamic tests, getting a close look at that lumbar spine there as well. Metabolic, I would be referring to a sports doc for that, and someone that's there's a few good ones that we've got in our network that they're used to dealing with runners, and that's something that they look for as well. But yeah, neurological, I think that's something that a chiro physio that specialise in runners should be adapting in assessing that there.
Yeah, and there definitely seems to be a pattern with a lot of these, a lot of the answers to. Oops, sorry.
No, there we go.
A lot of the answers to different running injuries is like different factors that you want to look at. So training loads is one of them. So whatever injury you're experiencing, maybe having a look at your training loads and whether you're building up too quickly, too soon. And then there's the aspect of the running technique, because there's adjustments that you can make to offload certain areas, but also remembering that load doesn't disappear. You'll just shift that load to other areas. So being considerate of that as well. And the last, the third pillar is like your physical capacity, like your strength and your tolerance to be able to take on those loads as well. So a few different main factors to look at, but common factors that do pop up when it comes to these recurring overuse injuries for sure. So if you kind of get stuck, like maybe do a review of your own program or your own situation, looking at your training loads, looking at your running technique and your strength, and seeing if there's any areas that you can pick up yourself that might explain what's going on.
Perfect.
Yeah, cool. If anyone else has any other questions, chuck them in now. Otherwise, we will sign off for the night. But this has been fun.
Yeah, it's been great. Yeah, thanks everyone for some really good questions tonight thrown at us. So put us on the spot, which is always good. But yeah, hopefully we've asked them. But certainly, you know, if anyone does have any further questions afterwards, then don't hesitate to contact us as well. So you can find us by our handles here, or via the clinic at Health and High Performance.
Yeah, for sure. And even, you know, for those who are watching, the just to give you a bit more information, like where we're based and everything. So we're based in Mont Albert, in Melbourne. Although, having said that, in today's world, we're also available online for
Worldwide.
consults. Yeah, exactly. Location pinpoint on the Earth,
Yes.
on planet Earth. And yeah, we're pretty much open Monday through to Saturday as well. So if you do want to find out more, then find out, on the website, healthandhighperformance.com.au.
Yeah, healthhp.com.au. Yeah,
That's
the one.
Health HP. All right. Well, looks like those are all the questions for tonight. So thank you everyone for joining us. Hope you all had a good day and have a good night.
Thanks, Trang. Thanks for having me on for my first time. It was it was relatively painless, so that was good. Thanks everyone for not asking too hard questions. So
perfect. All right.
Okay.
See you everyone.
Thanks, Trang. See you everyone. Bye.
Bye.